Hey guys, it's Garrison. I'm here in Dallas, Texas. I'm a chiropractic student at Parker University. Um, so today we're talking about how other specialties, dentistry, primary care physicians, orthopedics, how we can work together with them and vice versa. They can work with us to achieve the what's best interest for the patient. First thing that comes to mind for me is dentistry, with the ligaments and the nerves inside the mouth. Oral pain has got to be, in my opinion, has got to be one of the worst kinds of pain. You get a toothache, a cavity, or whatever you have going on. That's just I have little to no tolerance with that. It has got to be some of the worst out there. But one of the things that we can help with regarding the mouth or oral cavity with chiropractic is what's called your TMJ, and that's your joint right here. You've got two, it's bilateral, it's on both sides. It's what your bottom jaw right here, it's what lowers and goes back up to allow chewing, talking, doing what I'm doing right now. A lot of times it's pretty common for people to have dysfunction in the TMJ joint, and it's easy to see. You'll see the jaw kind of deviate or jut out, either forward, posterior, side to side. That can cause that can cause speech issues, that can cause uneven tooth wear. I mean, yeah, a fair amount of problems can come just from that simple little joint. It'd be a good idea to go get that taken care of, get it looked at, see if chiropractic can help with it. Um, Neurology is that's one of my favorite topics. That's the study of the brain. And man, being that chiropractic focuses on the nervous system, the brain is a pretty big component of the nervous system. It does control everything in the body, because the nervous system touches everything in the body, has some sort of um, function to do with your hair, eyes, skin, feet, you name it, nervous system's involved in it. We in chiropractic can't prescribe, we can't do anything internal, and that's fine. We can still get results through other exercises and therapies, focusing specifically on the neurology aspect of it. A lot of people we'll see come into the clinic, and they've tried surgery, they've tried the prescriptions, they've tried everything that their neurologist can help with, and hey, they'll send the patient over to us, and we'll run them through some therapy, some visual eye gazing, some um, you know, gosh, the list is endless as to what we can do. We call it functional neurology as the specialty in chiropractic, that focuses on the brain. And we get some really good results really quick, actually. Orthopedics is another hot topic. If you have joint dysfunction, that's going to lead to a lot of other problems, a lot of gait problems, walking problems. It can affect a lot of daily activities. There's really nothing that we can't help with, through chiropractic, and so I think at the end of the day, being a doctor is what is best for the patient, and leaving our egos and everything else at the door. We have to focus on who's in front of us and what's going on with them and what their end goal is. So if that's through chiropractic or another Western medicine specialty, it doesn't matter as long as the patient's getting what they want and living and leading a better life. That's what we're all out here to do. And that's what being a good doctor is all about.